Well, a pandemic of the unvaccinated. That's how the CDC is classifying our current COVID-19 situation across the country. As vaccination rates wane and case numbers have begun rising, the suggestion for everyone to put our masks back on is becoming more and more common. But we're curious, what is the risk for vaccinated people, specifically when it comes to this new Delta variant? Here to give us the scoop is Dr. Dean Winslow, infectious disease expert from Stanford University. Doctor, it's been literally just over a month since we were told we could take the masks off if we were vaccinated. Now here we are mid-July, essentially being told that wasn't really the best idea. What's your take on this new recommendation to wear a mask again?
Well, first of all, just think that it just emphasizes that we're not out of this pandemic yet. We're still in a lot better shape now than we were, certainly back in December and January when we were just seeing, huge numbers of cases and deaths and hospitalizations from COVID-19. However, it's really very clear over particularly the last 2 to 3 weeks that cases have spiked up all over the country. We're still not in as bad shape in the Bay Area as certainly the folks in Los Angeles are, and areas like Arkansas, Missouri, Nevada, for example, have already are seeing large numbers of hospitalizations, and again, a lot of concern. Clearly, this Delta variant is more transmissible. I think there's several reasons, though, why it's a reasonable idea for us to put our masks back on when we're indoors, mainly not just for protection of ourselves, but also it's not entirely clear that the vaccine prevents asymptomatic or minimally symptomatic infections. So all of us, like myself, who were vaccinated early on, it's still potentially possible, that we could spread virus to others if we were infected and had no symptoms. So again, I think until we start seeing the cases really dramatically decrease again, it really does behoove us as sort of citizens of California to put our masks back on, at least while we're indoors.
Well, and I know a lot of the cases that we're seeing mostly in unvaccinated people, but I have started to hear of different friends, family friends, who have said, hey, I'm vaccinated, but I tested positive for COVID-19. How big is this risk then for those of us who are vaccinated?
Yeah, it actually, the risk is not great in terms of getting sick enough that you would require hospitalization or more significant treatment. But again, I think what this does point to is that it is potentially possible to get reinfected. And then the concern would be that even if you yourself have no or minimal symptoms, that you could still potentially spread the virus to more vulnerable people who have not been vaccinated. So I think that's the reason that public health departments in the 5 counties in the Bay Area have made this recommendation.
Well, I know it seems as though, these new cases are coming because, many unvaccinated people decided to take their masks off with the rest of us. So that's how for this to become an issue again. How do we appeal right now to unvaccinated folks? Is there a way at this point to urge them to wear a mask or better yet, get vaccinated?
Yeah, to me, it's very sad, as someone who's, been alive for many years now and sort of seen how politics has evolved in the United States. But again, I'm really concerned that in a way we've become two Americas. But again, as someone who believes in science and trusts science and is part of this effort, I feel just so strongly. I just really wish that all Americans would understand that being vaccinated is the best way not only to protect yourselves, but to the loved ones around you.
Any tips on how we can, because I feel like everyone probably has someone in their lives that is kind of avoiding getting vaccinated or saying they want to wait. And someone told me just the other day, the Delta variant's going to take us back anyways, so why should I? And I'm like, the only reason it's going to take us back is if people don't get vaccinated. So any tips on how we can kind of convince friends and family?
No, you're exactly right, and unfortunately, though, also we have people in the United States that some of us pay attention to what are referred to as mainstream news media or science literature, and others, I think, unfortunately, are in kind of an echo chamber. And I just wish that prominent politicians, particularly in some of the red states, and perhaps even our former president, would just strongly recommend to everyone, to all Americans, that they receive the vaccine. Again, that's the way that we will finally get this pandemic under control in the United States.
Dr. Winslow, anything else you'd like to share in terms of what you know about this Delta variant or any other variants that, because I guess that's my biggest question, does the Delta variant now potentially change into a new variant that's even more transmissible?
Sure. Just the nature of viruses like this is that new variants will evolve, and we're already seeing additional variants, including there is some concern that a newer variant referred to as the Lambda variant, which is also more transmissible, may start increasing. But the good news is at least the 3 vaccines that have been available in the U.S. provide a significant degree of protection against all of these currently identified variants. So again, just as you were saying earlier, the most important thing is for all Americans to get vaccinated. The vaccines do work, they're safe, and they're effective.
Dr. Dean Winslow, infectious disease expert from Stanford, really appreciate your time this morning.